Um, Let me just tell you a little bit about myself. I'm a clinician and a researcher, and I teach positive psychology at the University of Utah. I was one of the co-founders of the recognized nationally undergraduate certificate program in positive psychology. And so I have been working as a clinician for 25 years, working with those with addiction. And I've really become kind of discouraged over the outcomes of most of patients that I've seen. Because recovery just doesn't seem to work for them in many ways. And I teach addictive thinking at the University of Utah, and it's been really interesting because that class has been one of the most favorite classes at the U. And I realized that positive psychology has a real good place in the recovery realm. And so let me ask you a question. How do you label yourself? And as you're thinking about that, this whole presentation, if you can think about that and how you do it, because again, many times we label people in a negative way. And I have found over the years that when we label people addicts, they become what we label them. And in positive psychology, I'm going to talk a little bit about our program, but I'm also going to talk a little bit about the positive psychology and what it is and how it works with what we're doing. Here are our, a few years ago, myself and others created this program of 10 principles of recovery. We created it a workbook that can be used, and we've tried it out in inpatient and outpatient, and actually it's being taught in universities. We are doing that this fall. And so some of the principles, though, I wanted to show you how they really interact really well with with recovery. So what is positive psychology? A few years ago, I was doing my dissertation on gratitude and learned all about it. And if you've ever been in a setting with social setting, or in your setting with people that are in your office or things like that, one of the number one things that I hear is, I'm just not good enough, I'm defective, and I just don't measure up. And I thought, why is the focus on this instead of what's right? And a few years ago, Martin Seligman and Ed Diener, who were the fathers of positive psychology, thought the same thing. Why are we working so much and doing research so much on depression and anxiety when we should be doing research on things that help with depression and anxiety? So the positive psychology was born. It's focused on wellness instead of pathology, strengths instead of weaknesses. And you can see, again, the traditional way kind of seeing addiction studies and psychology. And the one thing that really stands out to me, especially when I'm working with people, is we label people too much as an addict instead of positive things. And the traditional way is emphasis on pathology, abstinence, instead of positive, focus on health, wellness, flourishing. Positive psychology talks about the accountability and responsibility of the person instead of powerlessness. It's a strengths-based approach instead of focusing on what's wrong, weaknesses, and wrong behavior. Positive psychology is comprised of positive interventions. The science behind this posits that concepts or interventions used are implemented with the object of improving life satisfaction and happiness. There is a significant difference in this viewpoint. Instead of fixating on negative thoughts or dysfunctional patterns of behavior, interventions are created to increase positive feelings instead of staying stuck. The solution is emphasized. And those who have addiction can begin to feel comfortable, as we all know, in their pain and suffering and in their stuckness. But through positive interventions, they begin to see another way of being. And most of these positive interventions are things like meditation, mindfulness, changing neural pathways and negative thought patterns through gratitude and forgiveness. And it's so interesting to me because the research shows that those that are more at risk may have more to gain from positive interventions. So this is the recent research from the Society of Addiction Medicine. 10% of 12-step programs enjoy long-term success. That's only 10%. And people tend to drop out at a 40% rate during their first year. And informal treatment and AA groups have better outcomes. And so when we were thinking about this a few years ago, when myself and some of my colleagues, we think, can't we do better? So our program, which we've again outlined and done in inpatient and outpatient facilities, focuses on educational curriculum, where we spend a couple of hours each day or 2 or 3 times a week teaching the principles of positive psychology and how they intertwine with recovery. Then we also do exercise and activities that emphasize those educational things that we just taught. Then we have experiential groups and group sessions. The 10 Principles of Recovery program was created from evidence-based positive psychological principles. And again, as I've talked about, we promote self-reliance and independence. It's not a stepwise program, but it's a strengths-based approach. This is what we learned from putting it in and using it in several inpatient and outpatient programs, that language, we had to break out of the negative, that we didn't call people, again, addicts, we called them other things that they wanted to be known for, labels that they wanted to assign for themselves, because we found that the apologetic stance brings shame and defensiveness, and it really stops progression. We never treated people as if they were addicts, and that's what they said to us. We never felt shamed. We never felt like we were an addict. We also found that the modules, because the program is based on 10 modules, gave opportunities to talk about successes, not just problems. The other thing we learned was it was really important for the family or the partners or the spouses to be involved. Then the person didn't feel like the identified patient in the program. It's interesting because most of the people, we had to get to the active stage of change. We used Prochaska's stages of change and help them get to that stage of change, because if they weren't in the active stage of change, we found that they weren't going to progress very fast. So again, here are our principles, and I'd like to go over them just quickly so that you understand how they correlate. And actually, there's a lot of research on them in dealing with recovery. So the first principle is take accountability for your life. We all know that, again, that's really important in working with people who are in recovery, because if they cannot change, they want to change and take accountability and just blame others, that they're not going to change. And so that was one of our overarching principles that we started out with. And the interesting thing was, when people learned about the brain, and so we talked about the biology and what happens in the brain and what happens in the chemistry of the body when there's addiction. When they learned about the brain, they were so interested, and it was kind of like, okay, I know these things are happening inside of me now. How do I help the biology, and how do I help myself by understanding what's going on? It was just an interesting thing that they needed to learn. The second principle, discover purpose. We all know, we can understand that too, that substance abuse problems have been linked to lack of purpose and meaning in life. And if people don't have a sense of purpose, who are in recovery, they'll go back to their old ways. So helping people to understand that, and every day we would emphasize this as we went through this with them. We went through the program with them, we went through the principles with them, and then we would have them do activities that were correlated with the modules and the principles. The third principle is cultivate hope. Hope facilitates goal attainment, adaptation, and positive engagement in life. If people do not have hope, and we found this in our recovery centers, that if they did not have hope, then they felt helpless, they were more depressed, more anxious. Our fourth principle, practice gratitude. Gratitude actually is one of the most well-researched positive psychology concepts. A lot of research has been done on it to show that people who have gratitude actually feel better, both physically and mentally. And this is another one that's really interesting that comes from the research. Evidence suggests that disadvantaged individuals benefit more from gratitude interventions than healthier people. And I thought about that, and why would that be? And maybe it's because they focus so much on the negative in their life and what they have been working on or not working on in their lives and how stuck they are. Fifth principle is define and strengthen your spiritual self. We all know in most of the programs out there, this is a huge part of the program. There is an extensive body of research that connects spirit recovery and successful outcomes. And one of the things that we found out was that music was a profound source of spiritual connection for most of our people. This is one of my favorite ones. This is find your identity and nurture self-esteem. Again, it goes along with the labeling issue. As people labeled themselves in different ways, they learned to see themselves separate from and beyond their addictive behaviors instead of struggling with it and inside themselves and not being able to figure out who they were. And as they rebuild their self-esteem, self-compassion helped them get more self-respect, worth, esteem, and efficacy in their lives. The seventh principle, conquer with courage. I think people think that once they go through a program that everything's going to be okay. We tried to teach them that no, this isn't the way life is. It's going to be up and down for you. So we worked on resilience, growth mindset with Carol Dweck's work, and courage. And it was interesting that 25% of our men had the courage to change jobs after treatment in one of our programs. Forgive yourself and others. Self-forgiveness interventions that, as we know, decrease shame and guilt. And when men or people do not focus on their self-forgiveness, a lot of times there's poor recovery. Serving others was our number 9 principle. Altruism and unselfish acts, whether it's for yourself or for others, help them see things and life in a different way. And then our 10th principle, living with integrity, as we focused on this throughout our whole program, that being authentic, knowing who you are, labeling yourself in a good way, and being able to be honest with yourself, because if you're honest with yourself, then you'll be able to progress in your life instead of stay stuck. This was a theme that, again, was woven throughout our whole program. So how to implement this into existing programs? As I talked about before, we are putting this into some colleges. I've been teaching addictive thinking at the University of Utah for about 10 years now, and now we're putting this program into it, into our curriculum. And we're having great success with the students as they see things more in a positive way instead of a negative way. So in an inpatient or an outpatient program, you could replace some of the process groups with structured educational module learning instead of just processing groups. PowerPoint slides are available through our program and learning and helping people in the learning process. And we include multi-sensory learning experiences that help the modules and help to understand the principles that are being taught and are emphasized each week. When we focus on one module a week, one principle a week, the common theme is through groups, family sessions, and individual sessions, and it can be integrated with other programs. So you can email us if you have other questions, or if we can help you understand what our program is like in more detail. There's our information right there.